Hi everyone, I'm Naomi Brown, and for the next few minutes, we're going to be discussing Soarian and Medication Administration Check, MAK, two technologies that are utilized on a daily basis as an oncology nurse at CentraState Medical Center. So just hang tight, we're going to be diving deeper into these technologies. So what exactly is Soarian and MAK? Well, they're all-encompassing clinical electronic medical record and a medication administration system for healthcare professionals. These two systems utilize an analytical algorithm that bridge the two systems together. Soarian is based upon Cerner and MAK is based upon Siemens. Together, they create a comprehensive and a user-friendly workflow. Now, I'm just throwing it out there. How many people use electronic health records in their employment? How many of you actually like the electronic health record that you utilize? And your medication administration system, what is it? Is it a scanning barcode system or is it a paper charting system? I happen to be a fan of my hospital system. It is a barcode scanning system. And in the upcoming slides, we're going to be discussing how the systems work, specific features that have been placed to reduce medication administration errors, and CentraState's adoption of the system. So it wouldn't be a nursing presentation if we didn't have a little throwback. In order to talk about medication administration, we have to talk about the 5 rights of medication administration. And what other way to ask and talk about this than a select all that apply? Every nursing student's favorite question. Let's have a little throwback here. So what are the 5 rights of medication administration? Select all that apply. Patient, drug, dose, route, time, or all of the above. Yes, if you picked all of the above, then you are just right. And in order to know about MAK, you have to know your 5 rights of medication administration. So how does Soarian and MAK work? So I laid it out in 10 easy steps from the moment a patient walks into the emergency room to when they are admitted to a unit, to when a nurse on that unit has to administer a medication. So basically what happens is an emergency room nurse collects patient information, such as their chief complaints, home medications, allergies, their preference upon their pharmacy, documenting all this information into Soarian. The physician then sees this information and they order their home medications. They can add specific medications, they can hold medications, and they all enter this through CPOE. For those of you that do not know, CPOE is a computer physician order entry where a physician or a practitioner sits behind a computer and manually is entering everything via a computing system. Once a patient has been admitted to a unit, the nurse verifies the orders through MAK with the corresponding CPOE. So that means the nurse is going back and forth, CPOE to MAK, CPOE to MAK, and making sure that everything is verbatim between the two systems. Once everything has been verified as correct, the nurse can administer the medication following specific protocol. So in this case, in my hospital, the nurse will remove the medication from their medication dispensing system. They scan the medication via MAK while asking for 2 patient identifiers. Now for CentraState, name and date of birth is what we use, while simultaneously visualizing the patient's ID band around their wrist. The nurse will then scan the medications, the patient's ID band, and if a green check is viewed on the MAK computer screen, the computer algorithm verifies you, the nurse, are giving the right medication to the right patient, thus you can then administer the medication. The process repeats itself every single time a patient is admitted to the unit. Now, for my unit in particular, oncology, some of these patients are on our unit for a very long time, and the process will actually begin at step 5. There is no need to verify every medication from the get-go if they've been there for some time. So you would simply start at step 5. So the next slide is actually a visualization of MAK in itself. Zuckerberg San Francisco General Hospital and Trauma Center also utilizes MAK and Soarian. And you can see in the next minute and a half or so exactly what the system looks like from my perspective.
Steps on charting medication as administered. Select the name of the patient or patient. Select the name of the medication that you are going to administer by highlighting the medication. If 4 of the 5 rights are met, the medication line turns green. Select and scan each medication you plan to administer. If any of the rights can't be verified, the medication turns yellow and a check marks the line. Once all meds are verified, select the ID patient button. The system will tell you to scan the patient ID bracelet. Scan the barcode on your patient's ID bracelet. The system determines if you are giving the meds to the right patient. If no errors are present, select Chart. All selected medications are now documented. Certain hospital-defined medications will automatically require you to chart additional information. For example, insulin will require blood sugar, digoxin your apical pulse. Document additional information on the charted medication occurrence, such as vital signs, blood sugar, pain scale with location, and administration site in the highlighted yellow fields. You must ID the patient by scanning the name band before the fields are available to chart these additional information. Once data are entered, you may now click on Chart.
So there you have it, just a little blurb on exactly how MAK works. So reducing medication administration errors. In order to talk about it more, I want everybody to see how truly prevalent administration errors are. So as of September 2018, the Agency of Healthcare Research and Technology, despite considerable error reduction efforts, have noted 91 direct observation studies. Investigators estimated intravenous IV administration was even more error prone, with an estimated average error rate ranging from 48 to 53%. One study in particular estimated a 73% probability of at least one error during a single IV administration. The most common type of error was wrong time of administration, followed by wrong dose or wrong administration rate, specifically for IV meds. So you can see it's still very common despite very much efforts out there. So what does MAK do to defend itself against medication errors? So in the following slides, we're just going to talk about some of MAK's features that I use on a day-to-day basis to make sure that I do not give the wrong patient the wrong medication. So it eliminates legibility problems. So exactly what you can see here is the top picture. What I see on a day-to-day basis is clear, concise verbiage on medications, as opposed to the picture below it, which is a handwritten order. I'm pretty sure it says Coumadin 4 milligrams PO, but basically it eliminates legibility problems. It provides drug-related information. The beauty of MAK is the unlimited access to additional drug-related information. I click on Micromedics in the top left corner. You can see the picture, an evidence-based clinical reference that provides in-depth information regarding medications, side effects, IV compatibilities, and patient education. Top middle, you can see nursing protocols and procedures. If I'm ever in doubt, can I administer this medication? I just follow the specific protocol. And in the top right corner, my best friend is an oncology nurse, an embedded calculator that can help me verify height, weight, BSA. And lastly, in the bottom right corner, you can see circled, this is actually in MAK, drug information. I click on this. This is a quick blurb of information that comes up regarding side effects and pertinent patient education if I ever just want a quick synopsis regarding a medication. Provide healthcare professionals with pop-up features. So for this example, let's talk about the antibiotic vancomycin. In the top row, you can see this is basically if you were a physician. With vancomycin in my hospital, with the 4th dose, a vancomycin trough blood level is to be drawn. This is to remind the physician that is ordering the medication that on this date, they have to order a vancomycin trough level. So you can see April 18th, they have to order a vancomycin level. Now the picture beneath that is what I see as the nurse. So prior to a hang, I have to obtain a vancomycin level. This is basically everybody's on the same page. And it's important because you want to make sure that this antibiotic in particular is at the correct blood level. So say the trough is too low or the trough is too high, adjustments can be made. Next, we're going to talk about a 2-nurse verification process. So high alert medications are very common. As an oncology nurse, IV heparin infusions and chemotherapy agents are 2 high alert medications for an example. So basically, this is what we see as a nurse. On this screen, you can see a red tip pen. Unfortunately, I was struggling to find a picture, but high alert medications are noted with a blue tip pen. So that would notify that a nurse needs an additional nurse to verify a med. So basically what happens is 2 nurses independent of one another verify X, Y, and Z. They come together and they verify X, Y, and Z. The primary patient's nurse then scans the medication and is prompted with a pop-up that has to scan the secondary nurse's ID badge. This means that yes, independently, we did verify X, Y, and Z, and yes, we did come together and verify X, Y, and Z. Last defense is identifying lookalike medications. So the safe administration practice Institute released a list of lookalike medications. The pharmacy manager at CentraState actually uploaded this entire list into MAK, so every time a medication with a lookalike name is about to be administered, a pop-up automatically comes up and is to ensure the nurse that yes, you have retrieved the correct information and the correct drug. So here's an example of certain lookalike medications. As an oncology nurse, pain medication administration is part of the job. So you can see in the middle, hydrocodone, oxycodone. Very similar sounding, but two different drugs. A pop-up, if I wanted to give oxycodone, would say, are you sure you're giving oxycodone? It has a lookalike med, hydrocodone. This is just another defense to make sure you do not give the wrong drug to the wrong patient. And then finally, when did CentraState Medical Center adopt Soarian and MAK? Prior to 2007, CentraState Medical Center completed documentation and physician orders through written methods and telephone orders. Since then, CentraState has invested nearly $50 million in health information technology over the past 10 years as part of its ongoing commitment to enhance patient engagement and health data security. Specifically, the American Hospital Association has recognized CentraState Medical Center as one of the nation's most wired healthcare organizations. This prestigious distinction recognizes hospital organizations that have successfully adopted IT in 4 specific areas: infrastructure, business and administration, clinical quality and safety, and clinical integration. Overall, you can see Soarian and MAK are 2 systems that were implemented to improve patient satisfaction and outcomes and reduce staff errors. Both systems are very well liked and approved by the healthcare professionals at CentraState. You can see it has a very easy to use interface. The additional features provides healthcare professionals to complete their job professionally, timely, and most important, safely. You, as nurses, know safety is your #1 priority. Although human error is a major component in medication administration errors, Soarian and MAK are an additional line of defense to ensure that this does not happen across the entire healthcare spectrum. That is it, guys. I hope you enjoyed. We're in countdown mode. Happy Thanksgiving. Enjoy your holiday. Bye.